The Senate is set to vote on an emergency virus relief package and get it to President Trump's desk early this week. The bill includes a provision that would allow free coronavirus testing for all, including those that do not have health insurance. But the cost of being tested for COVID-19 is not what is stopping people from getting tested. It is the sheer lack of availability.
One thing the administration must focus on right now, above all, is fixing the problems we're having with testing. The United States has the best hospitals, doctors, and scientists in the world. Yet, currently, we are lagging far behind other countries when it comes to testing our citizens. We're behind the United Kingdom, behind France, behind China, behind Switzerland.
According to the Centers for Disease Control, only about 22,000 Americans have been tested for the virus. In stark contrast to the United States, South Korea is testing about 20,000 people a day. South Korea, which has a population of 51 million people, has so far conducted nearly 250,000 tests, whereas the United States, that has a population of 327 million, has conducted only a fraction of that. So why is the United States so far behind in testing its citizens? There are three major reasons. The first is because the US was slow to develop a coronavirus test. By the end of February, the World Health Organization was shipping tests to nearly 60 countries, but the United States declined these kits and opted for the CDC to create their own. But this is the second reason that tests were unavailable. In February, the original CDC-designed test kits contained a faulty reagent, so they were considered to be contaminated. But the FDA has said the issue has since been resolved. The last major reason testing wasn't widely available to the public was the red tape surrounding who was allowed to start developing coronavirus diagnostic tests. Academic labs attached to universities and hospitals that had the capability to develop these tests were not originally allowed to, and the FDA didn't change its regulations until February 29th.
The CDC's focus was to provide testing for the public health system. There's a whole nother system we need testing for, clinical medicine. And I'm happy to say now, with LabCorp and Quest both operational as of yesterday, there's really laboratory testing availability to any doctor's office that can go through LabCorp and Quest. I would have loved the private sector to be fully engaged 8 weeks ago.
Now diagnostic labs that previously met federal quality standards can develop their own kits. But ultimately, the problem stems from a lack of response from the federal government to act quickly to stem the flow of the virus in the United States.
Because of all we've done, the risk to the American people remains very low. People die from the flu, and this is very unusual. And it is a little bit different, but in some ways it's easier, and in some ways it's a little bit tougher. But we have it so well under control. I mean, view this the same as the flu. When somebody sneezes, I try and bail out as much as possible.
It is shocking. It is infuriating. If other countries can do this, why can't we? If other countries do it right, why can't we?